My name is Michael Noble. I am 21 years old, and I was born profoundly deaf.
My name is Sophia Schlager, and I'm 11 years old. I have bilateral implants.
My name is Theo, and I was born deaf.
My name is Emma, and I am 7, and I have 2 things called cochlear implants.
I'm Jagger Winkler, and I'm 5-year-old, and I'm deaf.
My parents did not know that I was deaf until I was about 18 months old, when some of the caretakers at the daycare center that I was going to realized that I wasn't babbling like the other children and suggested that I had my hearing tested.
At first, it's a devastating diagnosis for a parent.
We found out that she was profoundly deaf. The audiologist that we first saw told her that she would never speak.
When we first found out about her hearing loss, it was just kind of like, wow, the bottom fell out. What does this mean? You know, and we'll do anything we can. What do we have to do?
Having a new baby is one of the most exciting things that can happen to parents. And for them to be told that their perfect child has a hearing loss can be devastating. If there ever was such a thing as a good time to have a hearing loss, this is it. With the technology that's available today, we can honestly say that no child is ever going to not hear.
We left the hospital and we had ear molds made and got appropriate hearing aids. The audiologist at that point said, you know, just talk to him a lot. It's been a lot more than that, but in the end, he really was right.
Access is their big issue in any arena. That if they're given the sound, they're brilliant kids with all the same creativity and talents as everyone else.
Fish.
Hearing aids or cochlear implants and FM systems provide auditory access so kids can hear the information around them and learn language, learn academic material through their ears like their typically hearing peers.
We owe it to these kids with hearing loss that are spending the time and putting in the hours of therapy and wearing their technology. We owe it to them as parents and educators to do everything that we possibly can so that they get the access to sound that they need.
It's very important that you really have a good support team of parents, friends, your teachers, your speech therapists, your audiologists to really work together and help you maximize your potential.
Push.
Yeah. There we go.
Talking, Jagger.
We went to therapy 3 times a week, and it was really hard for me because I couldn't hear some things and I couldn't understand things. But as the years, it got better and higher, so I could talk like I am today.
Really, the teachers and the family and the friends and the audiologists, the doctors, and the speech therapists, that is what made me successful. So I'm really thankful that I had all the support that I had.
It's too big.
It's so important for us to realize that they're just a normal kid and they can do everything that's out there for them and they do everything just like a normal child. And really their hearing loss doesn't need to stop them from doing anything.
They just treat me like I'm normal. It's not like I need extra attention on everything I do. I'm pretty much a normal kid with a normal body and everything. It's just my hearing loss that's the difference.
Don't hold them to a different standard. Oh, they're doing great for deaf kids. That's really not the issue. It's, I want them to be doing good as an A+ student would do, because they can and they do.
Really has enabled me to do anything that a normal hearing person can do. I wouldn't have been able to graduate from college in a total of 3 years and was able to go through it without any kind of limitation.
I want to be a professional soccer player, then retire and return to surfing.
I used to want to be a doctor, but then I changed to a paleontologist.
This is a T-Rex, and it's pretty ferocious. I like to do sports. I love to eat chocolate. My favorite animal is a bear, and I love to ski. I can do anything that I want.
I also enjoy music. I like to play the piano.
It's a very big job and it takes a lot of people. But if we all work together and have the same goal, we expect kids who have hearing loss to do whatever it is they want to do. For more information, please email Liz Finnegan at tetonhospital.org or call 307-739-7516. The Pediatric Audiology Project is sponsored by St. John's Hospital Foundation.